Good afternoon, and welcome to another Facebook Live Lunch and Learn with the Center for African American Health. So CAA Health is hosting a COVID-19 vaccine clinic in our building tomorrow, Saturday, June 12th, from 9 a.m. to 1. It'll be the first and second doses of Moderna vaccine, so please feel free to come by. Vaccines are offered free of charge, and no ID is required to receive them. As well, next Saturday on June 19th, we'll be offering first and second doses for Pfizer. Same scenario, free of charge, no IDs required to receive them. If you need more details, they'll be available in the chat. And please share this information broadly with your family and friends. As we wait for a few more people to join, I'd like to introduce myself and tell you a little bit more about the Center for African American Health. My name is Deidre Johnson, and I'm the CEO and Executive Director of the Center. We are located in Northeast Denver and have been serving our community for almost 24 years. Our mission is the health and well-being of the African American community. As we move through today's session, please feel free to type your questions in the comment area and we will address them if time permits. So this pandemic has wreaked havoc on every aspect of our lives. For more than a year, we have all witnessed the tragedy of epic proportions related to COVID-19. Sadly, those who have suffered the most as a pandemic have suffered because of long-standing health inequities. And the pandemic has also put a spotlight on the deep-rooted racism and discrimination in America. Being Black in the US during the dual pandemics of COVID-19 and racial violence has taken an immense toll on our mental health. The community is collectively exhausted and overwhelmed by feelings of stress, grief, and worry about events that have taken place and the uncertainty of what's to come. My guest today is Dr. Anthony Young, a psychologist and the current president of the Denver Rocky Mountain Association of Black Psychologists. Thank you so much for joining me today, Dr. Young.
Thanks for having me.
So we appreciate you taking time out this afternoon to lend your insight and expertise on this matter. And as we discussed earlier, it's been a year since you last joined us when we started doing these series of conversations. So glad you were able to come back again. Please tell our viewers more about your professional background, as well as your work in our community.
Well, I've been a mental health professional in Colorado since 1977. My areas are primarily clinical and forensic psychology. I'm the current president of the Denver Rocky Mountain Association of Black Psychologists, and I've been a member since we started in 1977. I'm also a past national president of the Association of Black Psychologists and former chairman of the Colorado Minority Health Advisory Commission with the Colorado Department of Public Health and Environment. I'm also a former chairman of the State Board of Parole, and I previously worked as a clinical team leader for the Institute for Forensic Psychiatry at the State Hospital in Pueblo. And I've taught as an adjunct professor of psychology at the University of Colorado, Colorado Springs, and Pikes Peak Community College for over 30 years. I stopped teaching last year when the pandemic hit. And basically, I've been a volunteer with various organizations throughout my 44 years here in Colorado.
That's wonderful. So there's a long-running debate in our country about the definition of racism, which I find hard to believe, but it's true. Let's start the conversation with clarification about what the term really means.
Okay. Well, before I give you a definition, let me just say that it's very hard for Americans to deal with the issue of racism. It's something that is not taught in our public schools adequately. We know that our political leaders have lacked the political will and the courage to have an authentic conversation about racism. And if you ask 100 people what the definition is, they'll probably will result in you getting 100 different definitions. So I would like to just begin with saying that this is, once again, a very difficult issue for most people to deal with because it does evoke denial and anger and frustration. And because we don't always use the same definition when we talk about it, there's all kinds of confusion. So I like the definition that was created some years ago by Neely Fuller Jr., and he's an anti-racism activist. And basically, his definition is very succinct, it's very clear, and it talks about the true nature of what racism is. And to call it racism is to be polite. Truly, it is called white supremacy. But because we tend to be polite in these type of discussions, I'll use the term racism, but it's very important that people understand what I mean by it and not get caught up in your own definitions. So according to Neely Fuller Jr., white supremacy or racism is the direct or indirect systematic subjugation of non-white people by white people for the basic purpose of pleasing and or serving the interests of white people in all areas of activity, including economics, education, entertainment, labor, law, politics, religion, sex, and war. It also includes a belief in the genetic intellectual superiority of white people over all other people. This is a worldwide system of belief and behavior and really takes on the power of a religion in terms of it being so firmly believed and felt. And also, it's very important to identify that when attempting to discuss racism, it typically will evoke denial, anger, avoidance, and even rage in fragile people. And of course, as we know these days, there are even many politicians who are writing laws that prevent having an authentic conversation about this issue in the public school system. And we do know that dealing with racism will evoke a lot of cognitive dissonance in fair-minded people and at least contradictions in people who would like to avoid the issue. It's a very, very difficult topic, but yet talking about it is tough, but living it is even tougher. So while I have empathy with our white brothers and sisters and other people of ethnic backgrounds that have a hard time addressing the issue, when you're actually living it and you're being subjected to it with the micro and the macro aggressions on a daily basis, it gives you a whole different perspective when you actually go through it rather than just having to talk about it.
True, it's not a theory, it's very, very real.
Oh, absolutely.
So what are the main stressors that Black people are experiencing as they confront the pandemic compared to other ethnic groups?
Well, I like what comedian Richard Pryor had to say about this many years ago. Basically, what he said is that it's tough being human. On a daily basis, we have challenges and hardships and difficulties just being human on this planet. And you add to that having to deal with racism. So in addition to what everyone else has to deal with, if you happen to be subjected to racism, you have an exacerbation of all of the symptoms of the anxiety, of the depression, of the stressors that just anyone would have. Dealing with a pandemic such as COVID-19 is one issue, but we've dealt with the ongoing pandemic of having to deal with racism from the moment that people of African descent were kidnapped in their homes, attacked, enslaved, and brought to the Americas. So for over 500 years, we've had to deal with all of the stresses of being human in addition to the social conditions of health disparities, mass incarceration, et cetera, that we've dealt with. And we can talk about economic violence, housing violence, violence perpetuated by the economy, and so many other ways in which we have to cope and navigate being human under these conditions and dealing with the pressures and the anxieties and the disadvantages of having to live in a country that has not fully ever embraced our humanity or our status as a citizen of the country. So we have all of these issues in addition to dealing with COVID-19.
Very true. So the Black Lives Matter protests sparked by the murder of George Floyd drew attention to the issue that the Black community has known about for generations. However, seeing footage of the horrific display of police brutality and the many examples that followed was jarring to witness. The question is, to have you explain some of the ramifications digesting this content on a consistent basis. And I have to also add, it's interesting because over the years, when I was growing up, you would never see these images.
Mm-hmm.
For some reason, our society loves to constantly replay atrocities that involve Black bodies. And that's one of the things I noticed. It's almost like a trauma porn.
Oh, absolutely. In fact, it's very discouraging watching how the news media will oftentimes show instant replay after instant replay. They do this with sports, but they do it even more so when there's violence. So we can see the same clip while the newscaster is giving you their narrative, but we see the same clip over and over and over. And my first example of that was 9/11. I remember being home when the news was being flashed about the planes flying into the Twin Towers. And they kept showing this. This is like, I must have seen it 4 dozen times in 1 hour because they just kept showing it throughout the narrative. And we see the same thing in terms of the type of violence which has been perpetuated against people of African descent. And watching the killing of George Floyd over and over and over, watching it once is tough enough for the average person, but we find ourselves inundated with the images. But worse than seeing the images is having the vicarious trauma that many people of color have had to experience, having witnessed that type of violence within our communities. I remember growing up in Chicago, we were quite often subjected to police brutality and being stopped at all hours of the day and evening coming home from work. It was just typical. So it was not unusual for us to have these experiences, but I think what happens oftentimes is that there's a tendency to maybe become desensitized by being overwhelmed with the images. And that's what we don't want. Just like we hear about children who may become desensitized to violence by playing violent video games. In reality, when they're confronted with violent experiences, they may very well be desensitized to it. And so when we find that there are these images being shown time and time again, day after day, it can certainly evoke trauma that which is already existent based upon our experience in this country. We have intergenerational trauma based upon the violence that we have experienced. And watching this on TV definitely can exacerbate those type of feelings. But also, I would say that for people who are not Black, not people of color, watching those images can either make you more aware of that this is a real American experience, or there's a tendency to go deeper into denial, that this is just something fabricated, it's fake news. And when really we have a hard time addressing the reality that we're being confronted with in terms of that level of violence, because we would expect that in other countries, not in America, because we've been fed the lies about how much freedom and dignity and respect and honor we have for each other as Americans, yet we see this contradiction. And that contradiction has always been here. Most recently, we celebrated or acknowledged, if you will, the 100th anniversary of the Tulsa massacre. But Tulsa was not the only Black town that was destroyed. And Black Wall Street was not the only Black community which was devastated with being attacked by the burnings and the various murders. But yet we don't hear about this within our history. It takes a very courageous film writer or film producer to actually document that type of horrific experience. But once again, we don't grow up within our public school system learning about the true history of America. So therefore, when the truth is really revealed, there's a tendency for people to deny. And that's unfortunate, because the reality is stranger than very stranger than fiction.
really is, and I have to admit, most of I learned about Tulsa very young. That was from my father. It had nothing to do with the education system.
Mhm.
Um, During the pandemic, we've got some great questions coming in.
Okay.
During the beginning of the pandemic, something we discussed frequently was the fact that sheltering in place wasn't an option for everyone.
Yes.
A greater percentage of Black people were considered essential workers and therefore at higher risk of being exposed to the virus. How has that impacted our community?
Wow. In a very, very horrible way, because on one hand, we have the contradiction of being told by many of these essential workers that they have to show up for work, but yet they were being underpaid. And yet having to still expose themselves to the dangers and the risk of going into public, being unvaccinated, and a lot not being known about the virus when it was first um, um, emerging. And we also know that definitely with the issue of underemployment, being underinsured has all impacted Black people in a very significant way, because historically we have been devastated by health disparities, the health inequities, which are just pandemics. In fact, if anyone is interested in learning more about the manner in which people of African descent have been impacted by various health disparities, I would encourage you to look at a book entitled Medical Apartheid. It's an excellent text which gives just some history to give you a glimpse of what African Americans have been dealing with historically in terms of medical conditions. And now we add COVID-19 to the mix. So anyone who had pre-existing medical conditions just simply found themselves being disproportionately affected by COVID-19. And of course, with the health disparities that Black people have experienced historically due to racism within the medical health care system, we've just been, once again, even more impacted, more so than other people.
Social connection is an important social determinant of health. Social distancing prevented us from engaging with others as many of us worked from home and schools adapted to remote learning. How has this loss of social connection and isolation affected our mental health?
Well, first and foremost, people of African descent are communal. We enjoy our connections with each other, mentally, physically, emotionally. It's so important that we connect with each other frequently. This is just who and what we are as a people. And being communal has been difficult during the time of social distancing. In fact, I would say that we have to realize that social distancing does not mean to be socially isolated. So we can find creative ways of connecting. In fact, being able to use the social media platforms, the Zoom, the Google Meets, and all the others have been wonderful just to maintain some connectiveness with other people. Now, of course, with some of the restrictions being lifted, it's more likely that we'll gather physically. However, we still have had the issue of increased anxiety, increased depression caused by the social isolation. And really, we've had to make a very deliberate efforts to connect using the social media platforms. So I would dare say that we've had more levels of depression, anxiety. But by the same token, let me just point out is that we are a resilient people, because we know that we have a history of beating the odds against the odds, given the will to do so. So despite the pandemic of racism, despite the pandemic of COVID-19, we know that our ancestors have this legacy of beating the odds against the odds, because we're living proof about how resilient we are as a people. The fact that we can have this conversation in 2021 says a lot about the fact that we are the descendants of the ones who could not be killed because we're here, we're living proof of that. So in terms of being able to cope with this social distancing and the pandemic of COVID-19, being able to be more cognizant about eating healthier, meditating, avoiding toxic substances and toxic people when possible, being able to engage in such a way that we're using this time to intentionally and more frequently engage and contact our loved ones, our friends, our family, and to also do something which is quite unique. Oftentimes, we find ourselves engaged in entertainment. That's watching sports and music and stuff on TV. With social isolation and social distancing, this is a great time to also get more involved with entertainment. That's INNER, entertainment. Using this time to intentionally study our history and culture and learning the lessons from our ancestors about the challenges that they were able to overcome and to draw strength from that. Because too oftentimes we are not fully aware of the power that we have being knowledgeable about our history and our culture, because that in itself is a source of strength. But if you don't know that, you cannot draw strength from it. So that's part of our challenges during both of these pandemics, being able to be more connected with each other and also to use this opportunity to connect to our history and our culture and learn from those lessons. I like what James Baldwin said some years ago. History is not something that's dead and buried, because what we think about ourselves and what we believe about others have its roots in what we think happened in the past.
Mm-hmm.
So having that ability to connect the dots can really allow ourselves to have less anxiety and to have better understanding of the issues which are impacting us from both pandemics and any pandemics which may occur in the future. Being well grounded in who and what we are from a psychosocial historical vantage point is just something which we can draw strength from, despite what the environment and our society is bringing forth to us.
Are you all still doing the healing circles?
Yes, they're called emotional emancipation circles. We conduct those on a weekly basis. This is a nationwide program that the Community Healing Network and the Association of Black Psychologists have been engaged in our various communities for at least the last half a dozen years. And basically, emotional emancipation circles are designed to help people of African descent overcome the lie of white supremacy and the lie of Black inferiority, and to embrace our humanity. So we come together, we share our stories. It's not psychotherapy, but it's supportive. I would dare say that anything in which is therapeutic, or should say anything that helps, is therapeutic. But this is not designed to be psychotherapy, but a design of the EECs are designed to help us come together and to actually learn skills about how to work effectively and to overcome the vestiges of the lies of white supremacy or racism, if you will.
Okay. So what advice can you share with individuals who are dealing with anxiety about the world opening back up?
Oh, well, one of the main issues is to remember that as human beings, we are resilient. If you happen to be Black, you're even more resilient. But being able to stay focused on one's wellness, to be very mindful of the fact that danger is real, but fear is a choice. We don't have to fear COVID-19. We have to be aware that it's dangerous. It makes people very ill. It can even kill you. And to be very much diligent about using the personal protective devices that are available to us, to mask and to social distance and to avoid the type of behaviors which might give us unnecessary exposure to a virus. So there's definitely some things that we can do individually as well as collectively to make sure that we're mindful about our health and our loved ones and people who we may come in contact with.
So we have a few questions that came in.
Okay.
So when we were talking about being constantly exposed to violence and images, one of the questions was, how do you begin to treat burnout from seeing all this violence?
Okay. Well, the first thing is to disconnect. The power that we have is right here in our hand. We can cut off the TV. We can cut the news off rather than inundating ourselves watching news 3 or 4 times a day, which is what many people do. Watch it once. The same news you listen to at 7 o'clock in the morning is basically the same news you hear at 6 o'clock. So you don't have to inundate yourself with these type of images. That's the first thing. Second thing is to tap into activities which will divert your attention from being so involved with these negative images to really do something which is going to be more empowering, such as volunteering with various organizations, taking time for hobbies, taking time to meditate, taking time to de-stress and to decompress is so important because we find ourselves being overstimulated every day, all day. Either we have the TV on, we have the music on, we have all kinds of distractions. Making a quiet space where we can just focus on being calm for a moment, even if it's 5 to 15 minutes, can really help. And I would encourage people to consider going on YouTube and getting involved with some of the programs that help you meditate and to de-stress. All that can help. In addition to the fact that if you really would like to become healthier physically, be very mindful about the type of food intake that you have. Too much sugar, too much salt, fast food can all add to our unhealthy state, our dis-ease, if you will. So being very mindful of the fact that what we eat, we become in more ways than one. Not just physically, but also psychologically. Garbage in, garbage out. Be very careful about what you ingest mentally, physically, and spiritually. It's very important.
Thank you. How can we be constructive in healing ourselves first and then other members of our community? So I think you started on that. Your last answer touched on that, but this is also how can we kind of help our community heal as well?
Okay. Well, we start with our family, first we start with ourselves individually, collectively with our families, in our smaller communities, being able to engage in authentic conversations about our wellness, our mental, physical, emotional, and spiritual health is so important. We have some very deliberate, intentional conversations about what makes us well, what can keep us healthy. Too oftentimes we have these sidebar conversations, but what I'm saying is that we have to be more deliberate, more intentional about our wellness. So being engaged in social activism, being involved with the faith-based community, being involved in anything which is going to uplift the individuals, certainly, but also collectively. We have any number of civic and social organizations within the faith-based community. There's not a shortage of places to volunteer or to get engaged. I would just say that it's important to be very focused and very intentional about wellness and health. That should be at the forefront of our mind rather than as an afterthought.
Also, do you have any tips on how to start tough conversations in one's household about the connection of racism and Black mental health?
Absolutely. In fact, there are some great resources out there. I would like to ask people to look at 3 books and also 3 resources. One book is called Stamp from the Beginning. That's by Dr. Ibram Kendi. He's the writer of How to Be an Anti-Racist. Stamp from the Beginning is his first book. Excellent book. If you really want to understand this issue, that's the first book. The second book is The American Slave Coast by Ned and Constance Stampy. The American Slave Coast is a good complement to Stamp from the Beginning. And the third book I would like to recommend would be The Color of Law, which talks about the history of redlining and housing discrimination in the various federal programs and local programs. Excellent books. And for those who are interested in actually looking at some documentaries that talk about these issues if you happen to be white or non-white. Look at the documentaries and discussions by Jane Elliott, by Tim Weiss, and Dr. Robin DiAngelo. If you're interested in doing any serious work on being an anti-racist or understanding the issue of white supremacy or racism more effectively, those three lecturers and writers are wonderful to begin to address the issue authentically and honestly.
That's wonderful. And I think so often you find people think, well, that happened in certain regions of America. It happened everywhere. In
Yes.
fact, when I was a child, my father broke a covenant to move us into a neighborhood.
Mm-hmm.
So it's not, nowhere was immune to what was happening.
And it was legal. It was perfectly legal. In fact, I like a quote that President Obama stated some years ago during his tenure. He said, just because it was legal does not make it right. Slavery was legal. Rape was legal. Mutilation was legal. Housing discrimination was legal. So I think when we look at the issue from a moral vantage point, what has occurred has been a crime against humanity, a crime against our humanity. Racism / white supremacy is a crime against all of our humanity when we look at how devastating it's been for centuries. Not something that just occurs for 40 or 50 or 60 years, but actually over 500 years on American soil.
Thank you so much, Dr. Young. So we're almost out of time, but I do want to spend a minute or so for you to share any online resources you want us to post, as well as the community survey you're in the middle of.
Yes. Let me talk about the Mental Health Stigma Survey. The Association of Black Psychologists in Colorado have been funded to conduct a survey of the Front Range African American community to identify what are the type of stigmas that prevent us from engaging in appropriate help-seeking behavior. And the survey would be very informative in terms of being able to actually identify more specifically the type of issues we've had to deal with that has kept us from getting the help that we need. Now, of course, we do know that that these stigmas are very difficult to overcome, but being able to create ultimately some initiatives which will allow us to dispel a lot of these stigmas is going to just ultimately help more people of color engage in this type of appropriate help-seeking behavior. So what we hope is that ultimately we'll have more African Americans willing to engage in psychotherapy, counseling, rather than it being seen as something that only crazy people engage in. Because all of us have our mental health challenges. In fact, I would like to use this analogy. If you think about a spectrum, on one end you have people who are very adept, they're the best that they can be, as Spike Lee would say, they can only become more better. On the other end, you have people who are out of contact with reality, they're psychotic, they need medication, but most people exist somewhere in the middle. So, and we bounce back and forth based upon what stresses are impinging upon our lives, but we exist on this continuum, if you will, of mental wellness. And we can go to either extreme. So realizing that the challenges that we have mentally, emotionally, psychologically, whatever term we tend to use, is very much human. So while on one hand, we might be doing very well one day, the next day we may not be, being willing to ask for help when you need it. It's just like a person who breaks their leg. You don't hesitate going to a physician because that's the person who can help. But the same thing is true psychologically. If you have an emotional and mental circumstances which are being so challenging to you that you're having a hard time coping, it's important to get the help that you need, not from a best friend or your minister. They can help make the appointments for you, but you have to show up yourself, something that only you can do.
Well, thank you so much. I really appreciate you. And I know we were talking earlier about our having closed on our building, which is very exciting. But once, as the world slowly continues opening up, I would love for us to connect about doing an um, emotional emancipation circle later this year at the center. So let's work on that.
That would be our pleasure. And we'll do this certainly as a community service because we can never do enough to help each other heal.
Thank you.
You're welcome.
So we're out of time. This video will be available along with other information on the center's website at caahealth.org. Have a great weekend. Please stay safe and please take care of yourself. Bye-bye.